Hi, I'm Janelle Friesen. It is August 5th, and this is our COVID update from the health department. I'm here with Juliann again. You want to say hello?
Hi, everyone. Juliann Van Liew, the director for the Wyandotte County Health Department.
All right. Well, today we're just going to do some kind of quick updates on the status of COVID in Wyandotte County and what people can do. So I feel like not everybody's looking at our data hubs and updated on the numbers and that sort of thing. So do you want to talk a little bit about just where we are with COVID cases and COVID spread right now?
Absolutely. Unfortunately, we're not in a good space right now. We're averaging about 70 new cases a day. I think the day before last, we had 100 come in overnight. And so this is up significantly from where we were just 2 months ago. We were averaging 10 cases a day. So we're seeing a really significant surge right now. And we're seeing the surge for a number of reasons, but one of them, which many of you have heard about, is the Delta variant. And the Delta variant is different than previous strains of COVID. It's stronger, it's more transmissible, it's causing breakthrough cases even for the vaccinated, and it's affecting our kiddos differently than previous strains as well. So we really are in a place where we need to be concerned again, even those of us who are vaccinated. Our percent positivity is also way up. It's in a place where it hasn't been since mid-January. And a lot of our cases these days are coming out of our younger population. So in the last 2 weeks alone, 26% of our cases have been people younger than 20, and folks in their 30s and 40s made up 40% of our cases. So that's 2/3 of our cases are in folks younger than 40. And that really is concerning, especially with school about to resume here for many of our kiddos just next week. So unfortunately, the situation is pretty dire. We are seeing it get worse day over day currently. We continue to do everything we can in the health department, and we're back in that space where we're coming to the community and asking for your help to combat this surge that we're experiencing right now.
Yeah, it's tough to hear that that's where we are right now, but unfortunately, especially with the Delta variant, it's just and the fact that most people in our county still aren't vaccinated, we're just at high risk for that spread to continue. So, what can people do to help prevent that spread and help protect themselves and the people they're close to?
Absolutely. Of course, we want you to get vaccinated if you're 12 years or older. And we are making improvements week over week in our vaccinations. We're increasing a percentage or 2 percentage points. But in the immediate here and now, to really stem this tide that we're experiencing, we've got to get folks to put their masks back on. We know this is frustrating. A lot of us who are vaccinated, we felt like we deserved to take our mask off because we did the right thing in getting vaccinated. But unfortunately, vaccinated people can still get COVID-19 and absolutely can get the Delta variant. And so we need to move back to a space where if you leave your home and you're in a public space or a public setting among other people, even if you're vaccinated, we need people to put their masks back on. And that's partly for the vaccinated folks because you can contract COVID and not know it. A lot of our breakthrough cases are asymptomatic, meaning that they don't feel sick at all. And so they can be passing that on to people they love or people that they work with without knowing it. So right now, aside from vaccinations, which of course we're continue to promote, we've just really got to get back to that mask wearing that we were doing last winter and spring.
Right. So you need to have that mask with you when you're going into an indoor public space, or even if it's outdoors and maybe it's a setting where it's hard to maintain that social distancing.
Absolutely.
And as for vaccines, I think it bears repeating that vaccines are available for free. You do not have to have health insurance to get vaccinated. We still have vaccines offered at our Kmart site Wednesday through Friday, 10 to 6. But if that doesn't work for you, there are a lot of places that offer vaccines. So you can find one that's near you. You can go to vaccines.gov and search by zip code and find something that works for you. So we've talked about preventing COVID, but what if you do get sick or you do get exposed to someone who has COVID? What should you do next?
Sure. Let's start with exposures first, and partly because CDC has modified some recommendations. So if you're unvaccinated and you're exposed, you need to begin to quarantine immediately, and you need to get tested 5 to 7 days after that exposure. The change that's come out from CDC is that if you're vaccinated, you don't need to go immediately into quarantine, but they do recommend now that you get tested 5 days past that exposure. And so vaccinated or unvaccinated, if you're exposed to a positive COVID case, it's important that you turn around 5 days later and get tested. And that's just really important for community spread, because identifying those positive cases and keeping them quarantined and isolated are how we stop the spread from one person to the next. Now, if you feel sick and have any sort of COVID-related symptom, even if it's mild, even if it's a tickle, we're really encouraging people to go ahead and get tested. It's the best way to deal with COVID is to find out as early as you can so that you can, again, quarantine and isolate and take those precautionary measures. If you do feel sick and you can't get to us, please go online. You can request a test be brought to your home. You can mail it back in so that you don't have to go somewhere else. You can really do that isolation that we need folks to do. And again, we've got a lot of other resources online around transportation to our sites for testing or vaccinations, around food boxes and other needs that people have. So we just want to make sure folks know that we're here for a variety of needs.
Right. And those resources that you mentioned, people can go to wycovaccines.org, or they can call 311 for help. So that could be if you and your family need a ride to come to our vaccine site to get vaccinated, or if you want to request that home delivery of a saliva test, or you need quarantine housing when you need to quarantine or isolate. All those things are available for free in Wyandotte County. All right. Well, thank you so much, Juliann. I appreciate you talking about this today. And we hope folks will stay tuned for more info along the way.
Thank you. Hang in there with us, everybody. There are a lot of folks out there doing the right thing. So please know that you're not alone when you're putting that mask back on and when you're proud of your vaccination status. Those are positive things. And